everybody. Happy Monday. It's a good Monday, right? Why? Because it's hopefully for everybody a short week because it is Thanksgiving, well, at least in the US. So we're super excited about that. It's Monday, just got home from a pretty busy day, but I thought I would hop online and let you know about some cool things going on. Specifically, we are going to be giving away a book. I'm going to tell you how to get the book. So we're going to be giving away a copy of the Dog Cancer Survival Guide. This is a book that I co-wrote a couple of years ago with a vet school classmate of mine, great guy, Dr. Damian Dressler. So we're going to be giving away a copy of this towards the end of the live video, but it's not going to be that long. So hang on. I know it's a busy time. People either finishing up work or trying to feed themselves and their family. So if you have any questions, just put them in the comments. I would love to hear any comments that anybody has. You can shout where you're from or anything like that. I would love to hear all that. So let me make sure I got everything set up for that. So what we're going to be doing is I thought I would answer a couple of the common questions that I typically get every day when I tell people I'm a cancer specialist. So that can be some of my friends or maybe the person who's stuck sitting next to me on a plane when I'm traveling to speak at different conferences. And the first thing that, people say, well, one of the things they say is, you can treat dogs and cats with cancer? And I say, absolutely they can. And they go, they can get chemotherapy? And I say, yeah. And they go, are they going to get sick? And I say, no, they don't. And then the other thing they say is, gosh, your job must be so depressing. And the funny thing is, I love my job. Hey, Brandon, thanks for hopping on. So good to see you. But people always say to me, your job must be so depressing. And, dealing with cancer can be scary, and there's a lot of preconceived notions about it, but I actually love my job. And one of the things I love is that dogs and cats handle chemotherapy so much better than people. It's estimated that only 20% of dogs and cats have side effects. So look at the bright side, 80% of dogs and cats that get chemotherapy have no side effects. They don't lose their hair like people, which is great. There are a few breeds that can lose their hair. So some of the more common ones are poodles. They can definitely, and they don't go bald, but they'll thin out and it will grow back after chemo and just as beautiful as ever. Some of the other breeds we see, Westies and Scotties, their hair coat can kind of take a beating during chemotherapy. Old English sheepdogs. So any of the dogs that have that continuously growing coat, which is more like the human hair, they can lose their hair. But most dogs look pretty fantastic throughout their chemotherapy. And I'll be honest, dogs and cats don't really care, if they lose their hair during chemo. We care because we kind of like the way our pets look, but they're not going to care. Cats, if they're going to lose anything, just their whiskers, they do fine without them. They don't fall over. They do fine. And again, they will grow back after chemotherapy. So again, a lot of people really think my job is depressing, but we pretty much love what we do. Our patients come in, they're wagging their tails, we give them lots of treats, and I truly believe that they know that their cancer specialists are helping them. So I feel pretty blessed. I feel pretty lucky that I get to go to work every day and help families get through, this really difficult time when their pet is diagnosed with cancer, because it's super scary, and everybody thinks that cancer is a death sentence, but I really want people to know that it's not a death sentence, and there's a lot of different treatment options. So if you can find a specialist in your area, that's great. We'll throw down in the comment section a great resource, vetspecialist.com. You can put in your area code and see if there's a cancer specialist in your area. But if not, or maybe an internist can help you as well. But it's really helpful to get a second opinion when your pet has cancer, because it can be pretty scary. So again, my job is not depressing. I actually love what I do. Most of my clients, I tell them, if you're thinking about giving chemo to your dog or cat, give a dose or two, and you'll be pretty surprised how well they handle it. We will send them home with what I call just-in-case medications in case they get a little bit of nausea or a little bit of vomiting or diarrhea, which usually occur within the first couple of days after treatment. But again, it's usually going to be mild. They get over it on their own as the chemo's cleared from their body and their cells kind of repair themselves or make new ones. But again, we can give them some side effect or medications to deal with those side effects so they're not quite as bad. The other side effect, so we talked about they don't really lose their hair. They can get some GI, so gastrointestinal side effects, which could be vomiting, decreased appetite, and nobody likes to not see their pet eat. So that's a really important one that we have to focus on with my patients, making sure that they're eating and getting their nutrients, and then possibly some diarrhea. The third group of side effects is going to be a low white blood cell count. And luckily, most dogs and cats don't get so low that they get a systemic infection called sepsis. And we monitor their white blood cell counts before each treatment and then sometimes after treatment. And we'll adjust their chemo. And that's my job, is to adjust the chemotherapy and really tailor it to each individual patient so they can handle it really, really well. The other question I get is, how does a dog or cat actually get injectable chemotherapy? They're not anesthetized like they would be for surgery or like a dental procedure, and most pets are not even sedated. So actually I have some really great videos on my YouTube channel that you can go and watch dogs and cats get chemotherapy. Big dogs we often do on the floor in a blanket or a big mat, and they're often wagging their tail. They're just sitting there with the staff getting their chemotherapy. And then smaller dogs and cats we'll do on a table, but again, they just sit there, they're kind of checking it out. We're usually, you know, giving them lots of love and attention and trying to comfort them. So it's pretty amazing, and owners are always surprised that the pet just kind of trots off to the back, super excited, because they know that nothing bad is going to happen back there, and the pets really learn that, again, this is a safe place for them. So those are some of the most common questions that I get, you know, about being a cancer specialist and giving chemotherapy. So if you have any questions, feel free to just, you know, put them in the comments. And if you're watching this later, you can add them to the comments. So that brings us to the exciting part of this. So I'm going to be giving away a copy of the Dog Cancer Survival Guide, which is a book that I co-wrote again with Dr. Dressler. And it has a ton of different information about side effects, supplements, diet, and then, you know, the 10 most common cancers that we see. So there's a chapter on lymphoma, a chapter on bone cancer and mast cell tumors and mammary cancer and bladder cancer. So just a lot of good resources in there. And so to get this book, what do you need to do? I need you to do two things. I need you to throw a comment. Even if you're watching this on replay, please put a comment in the section below, and that will be the first to do for you. And then the second one is I need you to subscribe to my YouTube channel, so you can get notifications of the videos about pets, you know, their chemotherapy graduation day. We're just celebrating Remington's last chemotherapy. So subscribe to my YouTube channel. There'll be a link below this, and that you can use that. So two simple things: comment it below and then subscribe to the channel. And then probably sometime after the Thanksgiving weekend, after we're all turkeyed out, I will be, well, I won't be, somebody will be selecting a winner for me, and we'll let you know. And two little cool things that I'm going to throw in the envelope as well. I just got brand new calipers so you can measure lumps and bumps, because as most of you know, I'm a huge advocate for early cancer detection for lumps and bumps. So these are cool little calipers so you can actually keep track if you find a lump or bump in a dog and know actually what the size is. So my guidelines are, if the mass is the size of a pea and been there a month, I want you to go to your veterinarian and get an aspirate. And veterinarians, we have to stick needles in it, because I can't look at a mass, you can't look at a mass, whether you're a pet owner or a veterinarian or a technician, and know what it is. So we have to stick needles, find those masses early, because most skin and subcutaneous tumors can be cured with surgery alone if we find them when they're small. So again, the magic number that we're looking for these guys is 1 centimeter. Size of a pea, size of an M&M, size of a Skittle. So why wait, aspirate? And we also have these cute little caliper pens that I just got. So again, another way for you to measure and then keep track. So again, not only will you get a book, you'll get a pen and the caliper, which I just dropped on the floor. And that's about it. So again, really simple, just comment, subscribe to my page. Thank you for your love and support. I'm definitely gonna do more of these. So if you have questions, you know, that I didn't get to, feel free to put them in the comment section, and then be on the lookout, because we'll do more of these if you guys like them. Thanks, and have a super fantastic night. Why wait, aspirate, everybody.